Hello everyone, my name is Meagan H and I'm a pre-dental student at the University of Kansas. I have also worked for 3 years at a dental office, and today I'm going to inform you about the pros and cons of a term you may have heard come up lately called I did mess up. Do you want to start over?
Go back to the first slide.
Sorry, this is still the first slide.
Okay. 3,
Mid-level.
2.
Hello everyone, my name is Meagan H and I'm a pre-dental student at the University of Kansas. I have also worked at a dental office for 3 years now, and today I wanted to inform you all about the pros and cons of a term you may have heard come up lately, called a mid-level dental provider. First, I want to make sure that we're clear about the different people working in your dental office. Your dental hygienist is the person you go to regularly, or hopefully regularly, to get your teeth clean. The dentist is the one who does the restorative work on your teeth, such as fillings, crowns, and root canals. Your dentist most likely has 1 or 2 assistants in the room with him who help by handing him the tools and things like that. So what is the mid-level dental provider? They are advanced hygienists that are licensed to do simple but irreversible procedures such as fillings, extractions, and filing sharp edges off teeth. Anything out of their range would be referred to a dentist. You may be wondering, why the new position? Are things not working the way they are currently? Well, they were originally introduced a couple years ago to provide people that live in a so-called dental desert more convenient dental work. A dental desert is a region where there are very few, if any, dentists in the area. Currently, only Alaska and Minnesota have approved the licensing of mid-level dental providers, but according to Kansas Health Institute, 15 more states, including Kansas, are pushing their legislatures to license them. So today, I'm here to tell you about the pros and cons of licensing these mid-level dental providers. The first pro, and probably the most significant benefit, is that the mid-level dental providers will offer dental work to people that are in those areas called dental deserts. The Kansas Department of Health and Environment stated that in Kansas, the majority of all dentists are located in Wichita, Topeka, Lawrence, and Kansas City. The people in the underserved areas of western Kansas have to drive at least 30 minutes to the nearest dental office. In cases like this, patients tend to skip their appointments. This isn't good because disease in your mouth can cause problems throughout your entire body, and many illnesses can be diagnosed by looking at your mouth. The Center of Disease and Control and Prevention says that diseases and disorders such as leukemia and diabetes manifest in the oral cavity. Also, periodontal disease, also known as gum disease or gingivitis in its early stages, has been linked to strokes and heart attacks. Regular dental exams and cleanings are necessary to remove bacteria, plaque, and tartar, as well as detecting early signs of gum disease. In the long run, this can prevent many health problems. Serving the people in dental deserts and preventing future health problems leads to another benefit, which is cutting down visits to the emergency room that take up time and funds that could be put towards more important visits. According to a national report released in February by Pew Research Center, toothaches and other dental problems accounted for at least 17,500 emergency room visits just in Kansas in 1 year. Sally Yashin, director of the Children's Dental Campaign, stated that states spent millions of dollars on operating room charges to take care of those patients, and then they're back within a year or two because they don't go to follow-ups. There is a downfall to having mid-level dental providers in the underserved areas, and this is because people in these regions are bound to have more complicated treatment to work on because of their lack of dentist visits. In this case, if they need difficult fillings or work done, which they most likely will, most of their cases will have to be referred out because of the level of difficulty. Another plus of mid-level dental providers is that they can relieve dentists of their easy cases. This allows dentists to focus on the more difficult treatment, such as crowns, veneers, root canals, and things like that. Working at a dentist office the past 3 years, I've noticed that most days the dentist is scheduled full with fillings. It's harder for patients to get an appointment to put on their permanent crowns or bridges because these appointments take up much longer times. So the patients have to wait longer with their temporary crowns or bridges on, and they have to treat them very carefully since they aren't permanently cemented on. If a dentist had fewer fillings to take care of, they would have more time to do the complicated work that the patients need. Also, a pro of mid-level dental providers is that they would have cheaper rates for low-income areas. Since they have less experience and training than a dentist, then the work would be at a lower cost to the patients. Promoters of the bill say that mid-level licensing would also improve access to dental care for Medicaid patients by shifting routine care to a lower-cost dental staff member. Most dental offices in Kansas, including the one I work for, do not accept Medicaid because the compensation rate is so poor. If the rates were lowered, then the patients that cannot afford dental care currently may be able to afford work done by a mid-level provider. The last benefit I will talk about is that licensing the mid-level providers could cut down the competition in dental schools. Dental school is very hard and competitive to get into. The American Dental Education Association released a report on acceptance rates for dental schools in the United States. For example, the University of Missouri-Kansas City, every year they only accept 10 to 14% of their applicants. At other schools, it can even be drastically lower, going under 1%. If students decided to work towards becoming a mid-level provider instead of going to dental school, the competition would decrease. So now I'm going to switch gears and inform you on some of the cons of licensing mid-level dental providers. The first is about the amount of training they receive. Mid-level providers have 2 years of school at a university, 2 years of hygiene school, and then an additional 1.5 to 2 years of training to be able to perform fillings, simple tooth extractions, and other simple procedures. Dentists, on the other hand, have 4 years at a university and 4 years of dental school. The Kansas Dental Association said that 99.9% of Kansas dentists do not support licensing mid-level dental providers because it would endanger the patients. They said this because they know firsthand all the training they needed to perfect their skills. The supporters of the bill, including the Kansas Health Foundation, argue that anything out of the range of a mid-level dental provider's abilities would be referred to a dentist. However, even what is thought to be a simple procedure can quickly turn into an unpredictable, difficult case. Dr. Robin Hildebrand, a third-year dentist in Smithville, Missouri, argues that x-rays cannot foresee everything. She said sometimes you drill into a tooth and find out that a 1-surface filling you're about to do is actually a 3-surface filling. Also, what seems to be a simple tooth extraction could turn into a nightmare that mid-level providers wouldn't know what to do with. Once drilled in, you can't just send your patient off to see a different dentist. These are irreversible procedures. Another downfall to mid-level dental providers is their lack of so-called hand skill classes that are needed for the precision of the procedures they would be performing. Dr. Robin Hildebrand recalled from her dental school years that the first 2 years at dental school consist of a lot of hand skill building. She said, "It isn't something you're born with, you have to learn it. You have to have very good hand skills to do these procedures." They worked in labs on plastic teeth for 2 years before they could even work on patients. You might be wondering why the hygienists don't have to have all this hand skill training. This is because they're removing plaque and tartar, flossing your teeth, and polishing them, not doing anything permanent. The mid-level providers don't have quite enough training to be drilling in people's mouths and extracting teeth. The next con goes along with this lack of training. In dental school, students are required to study how certain medicines act together and how to handle risk patients with diabetes or high blood pressure and other pre-existing health conditions. If this stuff isn't known, it puts patients in danger of infection and even life-threatening situations. Kevin Robertson, the chief executive of the Kansas Dental Association, said that the extra 2 years of training for mid-level providers is not enough to learn restorative dental surgical procedures, science, anatomy, and emergency treatments should arise during a procedure. A dental student expressed their opinion on the subject also by saying that in dental school, they are only taught how to do routine procedures, but also how to be trained for thinking cases. Dentists, unlike mid-level providers, have the training they need to handle these special cases that may pop up during procedures. The final 2 cons I'm going to talk about are the shortcomings in the bills and the key reasons why mid-level dental providers aren't being licensed. The first is that the bill in Kansas does not require dentist oversight. In the 2 states that are licensed, Alaska and Minnesota, the mid-level providers have a dentist present in the building. The dentists don't have to watch every move or necessarily be present in a room, but should a complication arise, the dentist will be there. If there is no dentist in the building, then in emergency cases, the nearest dentist would have to drive there and take over, assuming they aren't in the middle of their own work. What's even worse about the situation is that if mid-level providers are working in the underserved dental deserts, the nearest dentist would be 30 minutes away, and if it is an emergency, the patient would be put in danger, especially if they already have pre-existing health conditions. The other shortcoming in the bill is that nowhere does it state that mid-level providers would have to set up their practices in the regions that are dental deserts. If this is one of the reasons for licensing them, then this should be required. There's a reason that there's a shortage of dentists in western Kansas, and that's because it's economically hard to hold a business in those areas and make a profit. After a mid-level dental provider gets their license under the current Kansas bill, then they could just start practicing in Wichita or Kansas City, where there's already an abundance of dentists and where they know they would be able to be prosperous. Overall, there's a lot to think about and many pros and cons to weigh out. Both sides have valid points. The supporters of mid-level dental providers want to provide dental services to the underserved areas. Serving the people in these areas would also lead to less emergency room visits and healthier patients in general if they go to their regular appointments. They also believe that patients that cannot currently afford their dental care may be able to if they see a mid-level provider. Also, the mid-level providers could ease up the dentist schedules by doing simple cases and leaving dentists with the harder cases. In the long run, competition could decrease in dental schools. On the other hand, the opposers of the bill do not believe that the mid-level providers have enough training to handle some cases, as well as any emergency situation. They also know that they have a lack of hand skills to be doing these procedures. Specifically in the states that haven't licensed mid-level providers yet, the opposers want to see a change in the bill in the lack of dental oversight, as well as the unrestricted places that they would be allowed to practice. The legislation may have more support if they have more restrictions put on them. So now that you are informed of what a mid-level dental provider is and what the pros and cons are of licensing them, you can weigh out the differences yourself and make up your mind whether you would want mid-level dental providers licensed in your state.